Hi, I'm Rachel. I'm a registered nurse for over 20 years,
Hi, I'm Lexi. I've been a registered nurse for 10 years.
and we knew just one part wasn't going to be enough for the two of us.
Welcome to part two. So have you ever had a patient come in and say, oh, can you fill this line with Botox?
That's a common question, and I really try to explain to them, like, Botox is not a filler. That's actually a separate treatment. Botox is injected into your muscle. So, what is it doing? If you already have two lines in between your brows, I say that it's not going to get rid of the line, but it's going to tighten the skin, it's going to smooth out the line, and it's going to prevent that line from getting any deeper.
And with consistent treatments, it will soften the line. I have patients who I've seen for a year, and we look at that first before photo we took with no neurotoxin in their face. And then we look at now, and that line is significantly decreased.
100%.
So that's really nice to see too.
Add that in with good medical grade skincare, and I feel
Yes.
like they're gonna be in a much better place.
I feel like every patient, their plans are obviously customizable, and you have to kind of sit and talk with the patient. What are your goals? I feel like sometimes my younger patients, they're doing a little more just like anti-aging, and their results are going to be a little bit more softer, and their brows are going to move, and just a little bit less movement. But when you're dealing with someone maybe who already has fine lines, we're going to want to tackle those a little bit more aggressive. And I think that's where we take it back to that FDA approved dosing of, maybe 20 units on the forehead for certain patients, just to make sure they get that longevity out of it.
And still just being mindful of, like, the aging process because, the way that you're putting 20 units in maybe a 35-year-old versus putting 20 units in the forehead of a 45-year-old could be completely placed a little bit differently. So I think just
Right.
it's customizable. It's based on that individual, their anatomy, and what really talking to the patient about, like, what their overall goals are.
Right. And I feel like also sometimes needing more. Some of my male clients, I do inject more than the 20 units on their forehead because their muscles sometimes are a little stronger, and that's okay.
Yeah, for
So
sure.
we just have to make their treatment plan a little bit more geared towards that.
Yeah, and just going back to that dose equals duration, like, we want this to last you, what it's indicated for.
I think it's so interesting how, the treatment plans can look different from patient to patient.
My first-time patients, they are more focused on, their budget, the number, and just area specific, whereas I feel like if you are seeing someone who's been, doing a neurotoxin for the last 2 years, they are happy with their plan. Now we're branching into other areas like, what can we do with my lower face? What options are out there? So that's where I'm finding the difference between, like, someone who's just kind of starting out and then someone who's been investing in themselves over the last few years. We're kind of like branching into some new areas, is super exciting.
And I think it's really important too, we're focusing on upper face anti-aging. We do have to focus on the lower as well, because as the upper face is aging, so is the lower. So we
Yeah.
have to treat them equally. So I think the fun part about this job is, a lot of patients come in looking for those 3 FDA approved areas in the upper face, but there are so many areas that we can treat
Yeah.
that, sometimes people don't know about, and kind of showing them the different areas. So what's kind of your favorite?
I would say, like, honestly, like, hyperhidrosis, I feel like is one of those things that people are like, wait, you can help me in that particular area if someone has excessive sweating. I think that's just a treatment option out there that that is available to patients that they don't even know about.
Palm sweat too.
Palm sweat.
Yeah, I feel like I have a lot of clients come in, having these Botox trends on TikTok and things like that. But one that's really stuck is the trapezius
Yeah.
Botox. If you're an athlete or you just hold a lot of tension in the trap muscles, we can actually inject that and give it a slimmer effect, or just help relax that tension in those trap muscles. So it relieves a lot of pain for people, which I think is a really great part of our job.
Got a lot of brides that have requested trap talks.
Yeah,
They're
'cause,
going to be in a strapless dress, things like that, just to kind of provide you with that slimming effect.
a lot of photos from, behind, and kind of seeing that trapezius muscle and giving it a little more slimming effect is really pretty.
Yeah, I feel like I treat so many people with the masseters. I mean, especially even dentists. I mean, they're coming in.
Right. TMJ pain, that's
Yeah.
whenever we clench and grind the teeth, and just helping with headaches and all of those areas.
Yeah, it's such a good option for patients out there if they're looking, one, for, like, to relieve tension, clenching, if they're also just looking for that slimming effect as well, it's just one of those treatment areas that's kind of nice to add in there with the lower face.
When you inject me, I have the one brow that sits a little bit lower. So we work on a lot of symmetry with my face and kind of help lift the one side.
I always tell my patients, like, if you split your face down the middle, your sister's not twins. So, you know,
Right,
we're
you're not
all a little
symmetrical.
asymmetrical.
Right.
Yeah. Coming up with a perfect plan to fit your face is what we're trying to do. I actually had a very unique situation recently, a really special case where I had a younger patient come in. She had had moya moya disease, a prior stroke, and left her with the right side of her upper face, like, with absolutely no muscle movement. So she had full range of like the left side of her forehead, and you know, it kind of gave her some character. She dealt with it for quite some time, had always kind of talked about possibly, you know, what can I do about this? So she came in for a consult. We mapped out a plan. I mean, obviously it had to be like very strategic with that whole right side of her face with no movement. You know, it's not, we weren't treating for fine lines and wrinkles and aging. We were treating for symmetry, for confidence, to make her kind of feel like the best version of herself. And I just explained to her, this can be a one-time thing. We can do this treatment. You don't have to keep up with it. If it's not for you, at least you tried because you've been interested. I think it's worth giving it a shot. She came back in 2 weeks. It was like so touching. It was the best results. Yeah, she was so happy.
Yeah, I think it's really, really special, you know, on one side of things, doing it for cosmetics and making these small adjustments for people and just making them feel more confident. And also on the other side of the things, you know, neurotoxin can be really beneficial for certain medical purposes as well.
We've both
Yeah,
treated a few patients, coming up with really specific plans for them, you know, to
right.
just kind of feel a little bit more like themselves, a little bit more balanced, symmetrical.
Working on some symmetry with
Mhm.
them. Yeah, yeah. And the treatment plans look, you know, a lot different
Mhm.
doing it for things that are more medical, but once you get that final result, I
Mhm.
think it's really special to see
Yeah,
how
and to see
happy
them
they
come
are.
back, yeah.
Right.
So touching, yeah.
Yeah. I love when new clients come in and they've never had any kind of injections or anything
Mhm.
like that. You can educate them, but I also do feel like it's debunking a lot of myths. So, what's kind
100%.
of the myths that you've heard that people come in with?
I think one, you know, it's just that fear of the unknown. You haven't done it before, so people are generally nervous. They're nervous to be injected with a needle in their face. They're nervous they're going to look fake,
Overdone.
overdone. They're going to be frozen. You know, if somebody's going to notice that they had a treatment done. I feel like those
Right.
are like some common things that I'm seeing.
I feel like we do have patients come in and that is their main concern. Hey, I don't want to look overdone. And I always have to kind of step back and educate them that, hey, neurotoxin isn't going to make you look overdone. This is something that is going to help you look refreshed and light and bright and just like you got a really good night's rest.
Yeah, we don't want you to look overdone either. Trust
Right.
me. We are coming up with a plan that really we want you to still look like yourself, but just a little refreshed.
Right.
Yeah. I have a lot of first time patients coming in with a fear that they're going to have an allergic reaction to the neurotoxin. Coincidentally, I had a patient come in specifically, you know, getting a Botox treatment and then experience some itching right after that treatment, a few days into the treatment. You know, was it the treatment? Was it something else? We treated it as if it were an allergic reaction and the symptoms resolved after a few days. But I always tell patients, you know, that is a true fear. We need to hear from you if that would be the case, but you would treat it like any other reaction, any type of allergic reaction with an antihistamine. Out of all the patients that I've treated over the last 6 years, that is the only one I can think of that has possibly coincidentally maybe had a reaction, allergic reaction. So I mean, you know, that chance is pretty minimal.
So another myth I like to dispel is, you know, patients will come in and say, if I start getting Botox
Mhm.
and then I stop about a year in, will my wrinkles get worse? No, that's not going to happen.
Mhm.
The natural aging process does occur.
Mhm.
Those muscles will start to contract again,
Mhm.
but Botox will, you know, start to slightly wear off.
Mhm. It's a very gradual process.
Right.
Yeah, going back to just educating and just kind of explaining the process of, you know, how it wears off.
Yeah.
At the end of the day, everybody's Botox treatment is going to look a little differently based on your anatomy and what your goals are.
Which is why it's so important to find an injector to create a customized treatment plan that's right for you. Like this video and subscribe to the Skin Center today.
Drop your questions in the comments. We'd love to answer them in another video. Thanks for watching.
See you next time.
Bye.